Oh, it's a spectacular morning. Time for Health Talk, brought to you by Providence Health and Services in Western Montana. I'm Peter Christian, and joining us here in studios, Dr. Beth Schenk. How are you, Beth?
I'm great. Thanks. It's so nice to be here.
It is good to have you. Now, if you wouldn't mind telling us a little bit about yourself, how you got to St. Pat's, a little bit of your background and training, things like that.
Sure. I'm a nurse and been a nurse for 30 years this month. It's just amazing to me how fast time flies. And I've been at St. Pat's 29 of those years. My primary clinical work was in the intensive care unit, where I've worked for about 15 years and had a special focus in cardiac care and cardiac surgery post-op care. I've also, for many years, been interested in taking good care of the natural world. And when I got to nursing, I realized, wow, hospitals create a lot of waste. This is a problem. And my first recycling attempt at St. Pat's was in 1993. And I remember and tell people now, that's when we didn't even use plastic bottles. So we only recycled the cans. We had these big cans to put our aluminum cans in. Since then, of course, we use a lot more stuff, including electronic waste. That's a new area of disposal. It's not new now, but it's new since 1993, how much electronic waste we have. You guys probably know about that here.
Oh, yes, we do. But, what's really interesting is I remember years ago when the whole computer age arrived, and it's going to be a paperless society, which really hasn't worked out that way, has it? And I would imagine in the medical field, where you have so many health records and things that have to be, codified, and the doctors and the nurses all have to look at it and sign for it and that sort of thing, that there's a lot of paper that has to be taken care of, right?
There is. Paper waste is a huge one. It's a big chunk of any landfill if you start to analyze what's in a landfill. Also, we went recently to a more widespread electronic health record. That was about 3 years ago. And we were told by people in our system who had already done that their paper usage would increase by about 50%.
Wow.
Isn't that the opposite of what you'd think?
Yeah.
And in fact, it did go up because we watched the number of reams of paper we buy every year. Mm-hmm. And so that amount did go up. But then, since then, we have actually decreased. So now 2014 numbers were less than they were 3 to 4 years ago. So we're finally starting to turn that boat around.
So let me ask you, why is this particular effort, why is it important at St. Pat's? Because, whether you believe in climate change or not, or whatever your political viewpoint is, there is a reason why you folks are doing what you're doing, and it's very practical, right?
Sure. Yeah, there's a lot of reasons. I guess first I'd say it's partly mission driven. So, St. Pat's is a faith-based institution, very strong mission statement. Our mission statement is, as people of Providence, we reveal God's love through our compassionate service, especially to the poor and vulnerable. So that's a great, solid mission statement that's not so much about healthcare. It's more general than that. Mm-hmm. We also have a core value of stewardship, as many different organizations do, but ours has a byline that says, we strive to care wisely for our people, our resources, and our earth. So that means anchored right there in our leading documents is a statement about taking care of the earth. So that's one reason. Another reason is as you decrease your environmental impacts, you also decrease waste. Now, I don't mean waste in terms of garbage, though of course we do, mm-hmm. but we force ourselves to be more efficient by thinking of the ways that we don't have to use a resource. We don't have to use so much energy. We don't have to use so much of a material. So that's helpful, helps us to run more efficiently. That then naturally saves money. So there is money to be saved in being conservative with materials.
I saw something on your website that just blew my mind.
Okay.
And I really want you to tell us about it. It's how you actually send these gigantic pipes down into the aquifer, right? And are bringing water up and using it and then recycling it and bringing it back and saving a whole lot of money that way too, right?
Yeah, that's groundwater cooling. And we use that at St. Pat's, and also some of the buildings at the university use that. We're sitting on this terrific, clean, cool body of water underneath our feet. And so we pump that water out at 48 degrees. It goes through chillers on top of our buildings, and we use that cool gradient, the coolness gradient, goes back in at about 60 degrees. So we have a 12-degree gradient that cools our buildings all through the summer. And it's thought that saves about 90 to 95% of our cooling needs in terms of electricity.
Wow. Well, especially when you have, say, 100 patients in your census, and they all have to be kept comfortable because, after all, it's a healthcare facility.
Yeah.
And so it's very important to have the right temperature. Mm-hmm. If you can't do that economically, then you're in trouble, right?
That's right.
So that is one way that you're stewarding the environment.
That's right.
What are some other things you're doing?
Well, another way, and just related to cost savings, is the waste management system that we have, which is fairly complicated because waste in healthcare is complicated. But in 2014, we are keeping about a ton of waste every single day out of the landfill. So that's through recycling, source reduction, reuse, not buying things that we don't need to buy, using reusable items like reusable dishes and reusable isolation gowns. Those are gowns to take care of people that the staff wear. So by doing a number of things like that, we are avoiding a whole ton of waste every single day, which is just a staggering amount. But that saves over $100,000 a year right there.
I was just going to say that it isn't just about saving energy as part of your mission statement. It's got a very practical deal here because it helps to reduce the costs, which hopefully eventually trickles down to the patient where they have to pay a little bit less for the services you provide, right?
That's right. And also in a case like St. Pat's, which is, as we've talked about, mission-driven, we do a lot of community benefits. So by running our operations lean, that means we have more resources available to help the community in other ways.
Okay. There's some other things here I wanted to ask you about. This is, by the way, a great handout. It's called Green for Good, Sustainability Report. So tell me where that concept came from, if you don't mind.
Well, I mentioned I had been recycling at the hospital since 1993, but it wasn't until about 2007 when our leaders got more serious about having a comprehensive effort. So we, in marketing and others, got together to think up a name, and the name that we came up with was Green for Good because St. Pat's, it's all about green. Right. Green means environmental stewardship. It also means money saving. For good means for the good of the world, and it also means forever. So
and G4G is kind of a cool.
That's right. Kind of catchy.
It's very catchy. So we have 122 motion sensors. We have 160 overhead LED light fixtures. I mean, these are things that not only are saving energy, but forgive me for being practical here, but saving a whole lot of doughs at the same time. Yeah,
that's right. So, and that was just done in 2014. So when we look at the history of our energy conservation alone, we save about $500,000 every year, based on what we've done to run more efficiently. When we look at our waste savings every year, not only what I just mentioned about the landfill, but also because we work carefully to keep our infectious waste to a minimum, we save about $300,000 a year. So yes, you're right. There is savings in this line of work. One thing I often say to people, if a hospital, which is just crazily complex, and the waste stream is so complex, if we can do this, any business can do this and can really benefit from the cost savings and from the environmental good that they do. And it helps to teach people who work there to what they can do at home, for instance.
Tell you what, we're going to take a little break here. We have lines open. If you'd like to ask a question of Beth Schenk about the environmental stewardship they're practicing right now at Providence Health and Services, give us a call. Lines are open, 721-1290. We'll be right back after this. All right, we're back on Talk Back and Health Talk. Sponsored by Providence Health and Services in Western Montana. Dr. Beth Schenk joining us here. And you have an entire list there of G4G. I feel like I should be doing like a hip-hop thing here. A G for G, a Green for Good deal. You've got a whole list there. If you can go through some of those items, that'd be great.
Well, thanks. Yeah, it's really fun to pull together a whole program. And I think about this in 4 big categories. Energy, that we've talked about. Waste, that we've also talked about a bit, reducing waste and saving money in doing so. Another category is toxic chemicals. So we want to keep chemicals out of the workplace and out of the environment. So we've done a few things to reduce chemicals in our foods, in some of our cleaning supplies, in our hand washing soaps, and that's exciting work to do. Also in some of our patient materials, avoiding some of the hormone disrupting chemicals that are there. Another thing that we work on is healthy foods. So we like to have, we offer a community-supported agriculture shares. So that means employees can pay ahead for a whole summer's worth of produce. And then they come in big boxes every Thursday. We just started last week. And these are offered by about 40 different growers throughout Western Montana through the Western Montana Growers Cooperative. Mm-hmm. And it's just been a really, really great. We have kids coming in to figure out what is this when they look at a jicama or a fennel.
I love jicama.
Or something. Do you?
Yeah, it's a Mexican potato, right?
Something like that, yeah.
That's what they call it.
And Jerusalem artichokes and kohlrabi. Do you like those?
No.
Yeah.
Don't go too far now.
And then also we have a Providence garden. So I don't know if you've seen the garden over at our North building off of Orange Street. So we turned a blighted parking lot. It was just a weed-filled lot into this really amazing garden, working with Garden City Harvest. And we had a wonderful donor who supported this. So it provides a place for patients to go because we have wheelchair height raised beds and standing height raised beds.
Cool.
For staff to go because it's a beautiful covered place. It's a beautification project in the neighborhood, and it helps us teach about the importance of food and healthy food. We also work on a bunch of different engagement topics. So we have Earth Week celebrations always. This year we looked at waste. We have a scrub exchange where people can bring in scrubs, that they wear, that they no longer want, and exchange them with somebody else's scrubs. We insist that they're clean, but then they don't have to throw them out.
So now is it possible for a highfalutin brain surgeon to get something with little cowboys on it that a nurse might have? Probably not good for the image, right?
It would be up to them. We don't rule about that.
Okay. It's kind of up to the individual taste, I'm sure, right?
That's right.
Okay, all right.
This year we did for the first time what we call the Dish Blitz. And the Dish Blitz is, I mentioned that we use reusable dishes in our cafeteria, which is a better environmental choice because you don't have so much waste, even including the chemicals in the water to wash. It turns out to be less environmentally costly. And so, and it of course saves money. But we tend to lose dishes. And so we are a big, giant hospital, all these different rooms with cabinets in them, 1,800 employees or so. So we did the Dish Blitz where we really encouraged people to get them back. We had raffle prizes, et cetera.
Yeah.
So that was kind of fun.
It's kind of like a library return, right?
Yes, it is, exactly.
Bring back the books, right?
That's exactly right.
Okay.
We had, for several years, we had the Turning the Tide conference. That was an educational conference talking about some aspect of where environment meets health, because that, in the end, is where it all comes back home. For me, I'm a nurse, and I'm concerned about ways that we're harming health through harming the environment. The most obvious way of that is in chemicals,
right? Because
that's what we know the most about, Superfund sites, et cetera. But we're learning more about other aspects as well. So that's something I pay attention to, and that's what my doctoral work was in. And so I enjoy being able to talk with people at the university and people in the community and people in our public health department, et cetera, working on all these things to help keep Missoula and Western Montana healthy for all of us.
Talk to me a little bit about the disposal of things like you guys call them sharps, needles, things like that have been used that could be potentially dangerous. So what's the procedure there to keep it environmentally friendly? Yeah,
you bet. Well, that's in the large category of infectious waste. It's called biohazard waste, sometimes medical waste, but it's really infectious waste. And that has to be either sterilized or incinerated before it can be disposed of. Okay. So we have a vendor who does that for us. We collect it in the rooms, and then it's specially marked in red containers. And that goes over to Butte, believe it or not, where it's autoclaved.
Wow.
And then it is shipped to Great Falls where it's landfilled. We're changing our process before too long, and that will eventually be actually shipped to Salt Lake City for incineration.
Now, I understand that you folks have won some national awards for what you guys do there at St. Pat's. So if you could kind of go over that a little bit.
Well, we're a member of an organization called Practice Green Health, and it is a national nonprofit organization that helps to just encourage this sort of stuff in healthcare because we know it's complicated. It's very content specific. There's a lot of technical stuff to know about it. And so they have developed an award system and a scheme to help encourage people to do as much as they can. And so, in 2010, for the first time, we were inducted into the Environmental Leadership Circle. That's a small group of hospitals, about 30 a year in the whole nation. So we were very proud of that and have continued to do that work. We've received other awards from the Sustainable Business Council, from the Montana Governor's Office, from the transportation boards. So, yeah.
Now, let me ask you this. Yeah. St. Patrick Hospital, part of Providence, okay? So are you guys kind of helping to lead the way within the Providence network and showing maybe some of the smaller hospitals how it can be done and perhaps maybe sending people like yourself to a place like maybe St. Joe's or whatever to say, okay, you've got a smaller operation, so let's try this and this and this. I mean, are there ways to try to spread that wealth, if you will, to some of your other facilities?
Yeah, well, great question. We really work at that. Providence is about 35 hospitals in 5 states, and about 20 of us meet every month. We have since 2008. Wow. So we talk regularly, and we know who's got expertise in what area and can call them up or email and say, hey, what'd you do about this? Do you have a policy about that? What do you recommend here? And so we really work together. I just want to call out St. Joseph for a moment, because St. Joseph in Polson, another Providence hospital, they have done really remarkable work with some of their energy work. And there's a scoring system called the Energy Star buildings. It's like Energy Star appliances, but it's for buildings.
Right.
And they have the highest Energy Star score in our system, and probably one of the highest in the Northwest. It's really quite interesting. So they've done great work on their own. They work hard on waste. We share waste together. We bring some of their waste down and put that all together. And so I would say that, yeah, we do. I'd say Western Montana, of the Providence stuff, Western Montana and Oregon are the two leaders in this area. So we are helping the other hospitals around the system as we can. Yeah.
Well, we're going to take another break, come right back and talk more about this. If you have a question or comment, the lines are open. We'd love to hear from you this morning. It's 721-1290 or 1-800-568-5309. If you'd like, you can make your question or your comment on our Facebook page. We'll be happy to share that with Beth Schenk, who's joining us here in studio on Health Talk, which will return after this time out. Hello, there we go. We're back on Talkback, 721-1290. But where's my microphone? All right. And welcome to Health Talk, ladies and gentlemen, sponsored by Providence Health and Services in Western Montana. Beth Schenk is joining us here in studio. She is a specialist in environmental stewardship with Providence. But we have a question from Brenda. Good morning, Brenda. How are you?
Good morning. I'm fine, thank you.
What's on your mind?
Well, I have heard that there's MRSA at St. Pat's, and I'd like to know how they deal with that.
As far as dealing with it from an environmental standpoint?
Well, keeping patients safe and getting rid of it if they find it evident, and just the whole question about how it's dealt with there.
Okay. All right. Well, we'll see what we can figure out. Go ahead, Beth.
Hi, Brenda. Thanks for your question. We have a full infection control team, and I'm not that person, so I can't answer a ton of detail about how we're fighting MRSA, though we do a number of different things that I know a little bit about. But I do know a bit about what we do with the waste that comes from working to fight MRSA and the any sort of contaminated materials themselves. So I'll focus on that. First of all, we use a lot of resources in fighting infection. Gloves, gowns, other personal protective equipment, it's called, a lot of chemicals to clean the rooms. We now have a UV light that we treat rooms with to kill latent bacteria. And one of the concerns that people often have in my area is, what do we do with all this waste? How do we avoid so much waste? And one thing I have said is, anytime we prevent infection, that's a better use of resources. So I consider it a value-added use of resources to fight infection, even when it creates tons and tons, I mean literally tons, of waste in gloves and gowns and dressings, etc. Any materials that are actually contaminated with MRSA or other bacteria are sterilized. So they're sterilized before they're disposed of, and in some cases they're incinerated. So that sort of stuff doesn't leave the building. And one thing that we have been able to go to recently for some of our isolation gowns is reusable gowns. And that might sound alarming, except that those too are sterilized. So then we're able to reuse the gowns after they've been sterilized up to 75 times without having to throw out a plastic gown for every single time someone would enter a room. I hope that answers some of your questions. I know it's not directly addressing the MRSA, the way we fight the MRSA. We need to get another person on for that.
Yeah. Well, it tells me is that you guys are doing everything you can within every discipline in the hospital to talk about the environmental stewardship side of what you do, right? From the garden to one thing I do know is a couple of years ago. By the way, I love eating at the St. Pat's cafeteria. It's great that you guys totally changed the way that you provide food there, and preparation and service and that sort of thing, right?
Yeah. In fact, most of the food at St. Pat's they call it from scratch. So that means that they do all the food prep right there. Right. And one thing that's kind of cool lately is they're watching the food waste created by each of the prep cooks. So every prep cook has a bucket. And so, you chop zucchini or carrots, you want to not waste. You want to have the smallest amount that goes into the bucket. And then they weigh the buckets at the end of the day. So this is a way to start to help train the food prep staff to lose less food waste, create less food waste. So that saves money. It's better for the natural world. It's better for the hospital finances.
We have exactly 1 minute left in the program. So if you could just kind of wrap up, Beth Schenk, and tell us why environmental stewardship is so important to Providence and St. Pat's.
environmental stewardship is key to the way we want to do business, just like we say we want to do our business with compassion. We care about how we treat people, and that's really true. We also care about how we treat our community and how we treat our larger world. So I think it is starting to go hand in hand with just the way we do business. It's not anything out of the ordinary. It's not anything, exceptional, but it is something that takes the constant drumbeat to just keep it going.
Every day by day, right?
Day by day.
All right. So how do folks contact you if they have questions they need answered? What can they do?
They could email me at elizabeth.schenk@providence.org, or they could call me. Should I do that?
Yeah.
329-2730.
All right. Beth, it's been a pleasure. Thank you so much for coming in.
Thank you so much.
All right. That's going to do it for Health Talk. Another great guest next Monday. Hope you'll join us then. We have Jenny Feynman's going to join us at the top of the hour as it'll be time for Talk Back.